Hi, everyone, and welcome. We're so glad you could join today's session, Kidney-Friendly Eating and Nutrition, a Q&A with Renal Dietitians. My name is Sheena Patel. I'm the Director of Public Education at the American Kidney Fund, and I'll be your moderator today. If you're living with kidney disease, you've probably heard a lot of advice about what you should or shouldn't eat, and often it can feel confusing, overwhelming, or even conflicting at times. And it's completely normal to have questions. So we're glad you're here today. Eating in a kidney-friendly way is important because the foods you choose can help protect your kidneys, manage symptoms, and support your overall health. And that's where renal dietitians come in. They're the experts in kidney nutrition and can help translate all that complicated information and turn it into practical, realistic guidance that's personalized to you. Today's session will feature two renal dietitians who will help answer some common questions on kidney-friendly eating. So feel free to drop your questions into the chat at any time, and we'll do our best to get through as many as possible. I do want to note that before we begin this session is for educational purposes only and should not be viewed as medical advice. Everyone's needs are different, so if you have a specific question, please talk with your healthcare team or dietitian about what's right for you. And with that, I'm excited to introduce today's speakers. First, we have Vanessa Conley, who is a renal dietitian with 2 decades of clinical experience. Her approach blends evidence-based medical nutrition therapy with a compassionate real-world lens, making kidney health feel doable, sustainable, and far less stressful. She also works to support people managing high blood pressure, diabetes, heart disease, autoimmune conditions, and plant-based lifestyles. She is the founder and CEO of her own private practice, Grain and Green Kidneys, serving people living with chronic kidney disease. Next, we have Kathy Wong, who is a registered dietitian. She works as a renal dietitian with DaVita Kidney Care, providing nutritional support to in-center dialysis patients. Kathy is also an active participant of the Academy of Nutrition and Dietetics Renal Practice Group. We're so excited that you are both here. Thank you for being here today.
Thank you.
Thank you.
All right, so with that, we have some great questions that have already been submitted, so I'm going to go ahead and jump right in. I want to start this Q&A with a question for Vanessa. We often hear the term dietitian and nutritionist used a lot, sometimes interchangeably. Can you tell us the difference between the two, and what specifically does a renal dietitian do, and how can someone living with kidney disease find one?
This is a really good question, and I get this a lot. So let's talk about a dietitian first. So a dietitian has a certification of a registered dietitian. They have gone through college to receive a bachelor's degree in dietetics or nutritional science. Some go on to also receive a master's degree as well. We finish with a dietetic internship that's often around 9 to 10 months at an accredited university. And then from there, we take boards to become a registered dietitian. A nutritionist, however, has a little bit different qualifications. Anybody can call themselves a nutritionist. You could do like an online or a weekend course to become a nutritionist. Some others go through some little additional schooling. The difference is, dietitians can provide medical nutrition therapy, especially when it comes to like chronic illnesses and diseases. And so saying this, going into a kidney dietitian, you have some kidney dietitians like myself who have further education and further like advancements in our education to become certified as a kidney nutrition specialist. And so that certification is a CSR. And so we are trained to understand the nutritional science behind the kidneys. And honestly, this is like the best route to work with somebody, especially if you have chronic kidney disease, because we definitely know the ins and outs of kidney disease and nutrition, and we keep up with the current research. A lot has shifted in my 20 years of being a kidney dietitian when it comes to nutrition. And you can find a kidney nutrition like myself online, on different social media channels. Definitely do your research before. But also, the National Kidney Foundation has a renal dietitian directory. And so, if anyone that is looking for a dietitian can also look on that platform and kind of see if there's one in their area.
That's incredibly helpful information. Thank you for clarifying between the two. And to piggyback off of that a little bit, Kathy, I want to ask you, given your work with in-center dialysis, can you tell us how dietitians work with nephrologists and other members of the care team?
Yes, so you can think of your kidney care team as like a high performing sports team. So the nephrologist is like the head coach, where they set the overall strategy for your care. And then you, as a patient, you're the athlete, and everything centers around you. Every other team member thereafter brings their unique expertise to support you for your success. So a dietitian is kind of like the assistant coach, the nutrition coach. We work closely with the nephrologists as well as your other care team members to make sure the recommendations, whether it's about the foods that you eat or the medications that you take, can work seamlessly in helping support your overall health and treatment. With that, it what comes into that is like if you're experiencing any symptoms or other things that you might have mentioned to your doctor or your doctor's trying to treat, we can then, the dietitian along with your other care team members, we all talk to each other as well as with you to come up with the best way to manage your symptoms and your health.
Thanks, Kathy. I think that's really important to highlight that kidney disease really is requires that comprehensive multidisciplinary approach. All right, so shifting a little bit, we've gotten several questions on different nutrients like protein, phosphorus, and potassium. And I know you two can testify that this comes up a lot, I'm sure, with your patients. So I wanted to start first by asking about protein. So Vanessa, this question is for you. Protein can be confusing for people with kidney disease. How much protein is appropriate, and does that amount change depending on what stage of kidney disease you have?
This is a really good question. It's often a question that I get a lot, like how much protein should I eat? And honestly, like I can't answer that for you because everybody's needs are different and it truly is individualized based on your kidney disease, any other underlying chronic illnesses, diseases that you might have. And so protein needs do vary based on your stage of CKD. And so that I will definitely kind of harp into. What I can't do is like recommend like a set amount because like I said, everybody is different. So with earlier stages of CKD, especially like stage two, early stage three, we definitely want to still focus on protein, right? The key is we don't want to have too high of a protein diet because we know, right, that too much protein can create more overwork for the kidneys. And so what we're trying to do is create less overwork and protect the kidneys long term. And so we want to look at typically the quality of our proteins versus like the quantity of our proteins. So is our protein sources coming from like lean quality proteins like chicken, turkey, fish, eggs, plant sources like tofu, edamame, beans, lentils, things of that sort. We definitely want to be mindful of the portion size of the protein at this stage as well as at advanced stages of CKD. Both can fit in a kidney-friendly diet. It just depends on, one, your CKD stage, two, any other additional lab work, and then three, we want to best support the kidneys without overworking the kidneys. And so when we're moving into like stage four and more so into stage five, protein definitely is important. We definitely need to be mindful of how much that we are consuming. Some folks might need to go less on their protein and maybe swap some of those animal proteins for plant proteins just to add an additional kidney protection and to kind of create less workload for the kidneys. During this whole process, depending on whatever your stage is at, we want to emphasize incorporating like fruits and vegetables when we are having our animal proteins just to create a lot more nutrients and fiber, which really helps with supporting kidney function and kidney disease.
Those are some great points, and also just highlighting that protein needs can vary for everyone, and it's not that one size fits all. I do want to call out we have our Kidney Kitchen website. I'll have someone from the team drop in. We have a protein food guide that has different foods and lists kind of how much protein content is in them. So that can be really helpful for just educating yourself and meal planning as well. So this next question, kind of sticking to our nutrients, is for Kathy. So I want to talk about potassium a little bit, and this one comes up a lot too, especially for people who are not on dialysis. Kathy, could you tell us a little bit about what kidney patients need to know about potassium? Do they need to limit potassium, and does that guidance differ for if you are or aren't on dialysis?
That's an excellent question because it's a very common topic that comes up. So to answer the first question, do all kidney patients need to limit potassium? The answer is no, not necessarily. And to tie into, I think, the second or third question. So what is potassium? Potassium is mineral your body needs for just everyday function. It helps your muscles, your nerves, your heart function, and it's found in many of our foods. So sometimes if we're just honing in on thinking I'm going to limit it, not knowing truly why or if you really need to, it can feel very defeating because it's honestly in lots of different foods. But that's not necessarily bad. A healthy kidney keeps our potassium in check. And so we would, when our kidneys are working well, whatever we eat, we would excrete the rest that our body doesn't necessarily need. When our kidney function declines, when it doesn't filter as well, potassium is one of those first things it isn't able to filter as well. And for different people, and especially in different stages of your kidney disease, that ability to filter potassium might be different. And so it's hard to say just because you have kidney disease, you have to limit potassium. That is absolutely not true. Some people with kidney disease, their kidneys are still able to filter potassium so they don't struggle with it. And so that ties into the second question. Does the guidance differ for someone who is on dialysis versus not? Not necessarily, because the key is how well your kidneys are able to filter. Even if someone's on dialysis, sometimes their kidneys are still able to filter potassium quite adequately, especially with the help of the dialysis machines and the dialysis process. And so they may not need to limit the potassium as much. So the key isn't so much whether you're on dialysis or not, it's how your kidneys are functioning. And so to know that is to be able to get your regular lab tests and work with your nephrologist or your dietitian to know exactly where your kidney function is at in order to determine whether or not you need to limit potassium. And then I think the third question was for someone who has been told that they need to watch out for potassium, how can they balance how much they can eat and what kinds of foods they can eat? That's an excellent question because that goes back to that first comment I made. Potassium is found in many, many different types of foods, especially in fruits and vegetables. And so it can feel contradicting, like these are healthy foods, but why am I limiting them? Well, it's again, because of the potassium content, but that doesn't necessarily mean that they're bad foods. It just means that sometimes, especially when the levels are high, knowing what foods, especially some of the higher potassium foods like oranges, a lot of the tropical fruits, mangoes, watermelons. They're not bad. Please know they're not bad. It's just that knowing which foods are high in potassium and being mindful of limiting your intake of them. It doesn't mean you have to completely cut them out. It's just being mindful of how much. And the best way to know is to work with your renal dietitian.
Thank you, Kathy. That's really, really helpful. What I'm hearing is just that with protein and potassium both, it's really dependent on the individual and where they are. I also want to call out, and we'll drop a link. We have a potassium food guide also on our Kidney Kitchen website that kind of has some of the common foods that are high, medium, and low in potassium to kind of help with just meal planning as well. And I think that that's a really comprehensive guide. As we're sticking on nutrients, I want to talk to Vanessa a little bit. If you could tell us, a lot of other common questions we get are about the role of phosphorus in kidney disease. Can you tell us a little bit about why phosphorus is important to monitor, and how can people realistically manage phosphorus without feeling very restricted, especially with potentially having other restrictions that they're watching?
This is a good question. I get this question a lot. Phosphorus, like potassium, needs definitely vary throughout the stages of CKD, right? Phosphorus is definitely a mineral. It's got a lot of functions in our body, more so in relation to kidney disease. It's a good marker for like bone health. It's also a really good marker for like energy. We need it. We need ATP. That P is that phosphorus. Okay, so the goal isn't to have the least amount of phosphorus in our diet or no phosphorus in our diet. We still need phosphorus for just everyday bodily functions. And so it can become more so of an issue when at later stages of CKD, and then if somebody is on dialysis, because at that point, like Kathy mentioned, as CKD progresses, the kidneys do struggle with keeping a happy balance of our electrolytes, and phosphorus is one of those minerals that the kidneys can have issues with keeping up and keeping a happy balance. And so the biggest takeaway that I really want to stress, especially for folks in those earlier stages of CKD and then even later stages and even on dialysis, there is different types of absorption of phosphorus from the foods that we are consuming. And so it falls into two categories. One is inorganic, which is the man-made chemicals that are found or additives in our foods, the phosphorus additives. And then there are organic phosphorus that's naturally found in our foods. And so it's not just dairy and nuts and yogurt that you would read online. Phosphorus is in everything that we eat, just like potassium is in everything that we eat. But the absorption depends, right? So if it's coming from plant-based sources, so these are your beans, legumes, lentils, the absorption rate is going to be way less compared to phosphorus absorption from animal products. So this is your beef, your chicken, turkey, fish, eggs, anything that's, meat or animal. And so that absorption is going to be a little bit higher, anywhere from like 60 to 80%, whereas phosphorus from plants and fruits and vegetables is anywhere from like 30 to around 50%. And so what I tell folks more so, I'm more worried and concerned when you are consuming a diet when it has a lot of convenience foods that contain the phosphorus additives. Phosphorus additives can be very damaging for CKD, regardless of what stage of kidney disease that you have. The absorption rate of phosphorus additives is almost around 100%, and it's really harsh for your kidneys to process. So I would like, instead of having folks focus on like foods to take away, my approach is different. We want to support what's on our plate and we want to add foods to our plate. So I would rather somebody enjoy, some beans and rice, right? Versus having to avoid the beans because it has phosphorus, but then you're maybe ordering out and getting like a frozen dinner that's got like two different types of phosphorus additives in them, right? That is going to be more damaging. So I would recommend putting that back on the shelf and finding another frozen dinner that does not contain phosphorus additives. And you would find them in the ingredients label of the food product. And so they are big, funky words. And the best way I tell folks is if you look for a word that has the letters PHOS or phos, that's your clue that it's a phosphorus additive in this product and it's not the best choice for CKD. So try to put that on the shelf and find something different. The additives can be very, very sneaky. So again, the goal is like avoid, 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 but we're going to do what we can as best we can to limit, to have less of those phosphorus additives into our diet. But it does, phosphorus levels, high phosphorus levels can impact our kidneys. It can definitely impact our bone health. It's a thing we call renal bone disease, and it can make your bones really weak and brittle. And too much phosphorus can most definitely affect our heart health. And so our heart health and our bone health are directly tied into our kidney health. So it's really important to be mindful of it, but it's more so looking at the sources of where the phosphorus is coming from. And again, working with your dietitian to know what is best for you.
Thank you so much. That was all very helpful and very thorough. So, kind of on this same topic here, we have a question that came in. So, Kathy, maybe we could take this one. How often should someone advocate for lab testing to get their potassium and phosphorus checked?
It depends, mainly because the cadence of it, from what I'm aware of, is as you progress into your later stages, I believe it's stage 3 or so, your nephrologist may want you to get more regular lab checks. So the short answer to that is to advocate for getting labs checked, really talk to your nephrologist. And if you haven't gotten a referral to see a nephrologist because you're only being followed by your primary care doctor, then please, please, please ask your primary care doctor to refer you to a nephrologist, because they are the ones who generally will monitor the labs more closely than nephrologist. And they may also want to see you more often to make sure there's no sudden change with your kidney function. I want to emphasize that because I've worked with some patients that know that they have CKD, but they don't know what stage. And that's not very helpful, because in the early stages of CKD, knowing exactly what stage you're at means that the doctor knows relatively where your kidney function is at, and therefore make the most adequate, make the most like proper recommendations for you at that time, especially surrounding nutrition, because that in itself is what can pro slow the progression of kidney disease if we can catch it early enough and really limit the protein intake so it doesn't overwork your kidneys. Because when that is ignored or not closely monitored, that progression can happen really fast.
Thank you so much. That was very helpful. And on the same topic of phosphorus and potassium, Vanessa, maybe you could help us answer this. What are your takes on diet and sugar-free drinks and foods? Do these specifically contribute to a phosphorus or potassium load?
So it depends. Some diet products, some sugar-free products can contain phosphorus additives. So really, it's the key is you really have to check the ingredients label on a product to identify if there is in fact a phosphorus additive. So, and it doesn't matter if it's like diet, regular, sugar-free. It's just these are, additives that they add to increase shelf stability for a lot of these food products. So from that aspect, I would definitely check the label. Now, when it comes to potassium, yes, diet products and sugar-free products can contain potassium additives as well, like potassium sorbate, for example, it just popped in my head. So for somebody that might have chronically high potassium trends, or they go up and down a little bit, and you are consuming a considerable amount of like these diet or sugar-free beverages that contain potassium additives, then that would definitely be something to look into, potentially reducing that amount or just swapping it with another beverage that does not contain phosphorus and potassium additives. And then again, working with your dietitian and doctor just to see, if that is an option for you. But yes, too much of those additives can definitely pop in those beverages, and you just got to be more mindful of that.
I have one thing to add. Um, when Vanessa mentioned potassium additives, uh, aside from sweeteners, another thing to be mindful of when you're shopping at the grocery store is when you see no salt or low salt. Because what I've noticed now in the grocery stores, when they say that, and I flip the back to read the label, they use salt substitute, which has so much potassium. The base of it is potassium, and so you may be avoiding the sodium, but you're adding so much potassium to that bite of food. And so whenever you are searching for or you see a low sodium or no salt item, just flip to the back and check to make sure they don't use any salt substitute.
Thank you. Thank you to both of you. I think those are some great tips to keep in mind. And label reading is definitely important, I think, in general, but especially for people with kidney disease. So I want to switch gears a little bit and move into another topic. So this has come up a lot lately, talking about eating on a budget. So Kathy, I'll have you start with this question. How can people eat in a kidney-friendly way while staying on a budget? And what are some affordable food swaps or strategies that you would recommend?
That's a really good question, and I totally hear you because the cost of living now is through the roof. And sometimes following any kind of diet can feel very challenging. The first thing that comes to mind again is to work with a renal dietitian to know exactly what a kidney friendly way of eating is for you, because not everyone's kidney friendly diet is the same. Secondly, more surrounding a budget friendly way of eating is I'll list off a few because I had a feeling this is going to come up. So the first thing to keep in mind is to plan ahead. I think the best way to be able to work within a budget is to be able to have a map, a plan in ahead of time. I hopefully if it's for the week, for a month it's kind of difficult. I struggle with this myself, but it truly does help with budgeting your meals. And so some staple budget friendly foods can be things like rice, pasta, oats, tortillas, eggs, dried beans, lentils, frozen vegetables, even canned fish, especially if you look for the canned fish or tuna that's not in the salty water or low sodium. Those are really good, and they're low cost staples. Another way to keep in mind a general kidney friendly way of eating is to be mindful of the sodium, the amount of salt that are in the foods that you purchase. Oftentimes, a lot of the processed foods tend to have a lot of salt, and nowadays they may not be that much more cost effective to buy the processed foods. Sometimes buying the more fresh foods and cooking in bulk might stretch your dollars a little bit more. And by cooking on your own or cooking at home, you can most definitely know what's in your food and be able to be mindful of how much and what's in there rather than guessing or having to flip the label to the label each time. Another way is looking for smart protein choices. Vanessa mentioned several of them. And just to list out some that I remember, she mentioned eggs is a good one. Eggs are an excellent source of protein. I mentioned earlier the canned tuna, canned fishes, make sure that it's in water and low sodium. Chicken thighs are really good. Chicken breasts, they tend to be like less than if you were to purchase some beef, because beef is pretty expensive. Dried beans and lentils, those you can buy like a bag, and it yields a bulk when you cook it in a batch. And so plant proteins actually are often the least expensive source of protein for you, a good choice. Another one is using frozen produce. Sometimes we think, oh, frozen's bad. Not necessarily, especially if it's just straight frozen vegetables. Because what they do in the manufacturers, they grow it at its peak season, harvest it, and flash freeze it. So you get actually pretty good quality vegetables that way. And so that's one way you can budget your meals, especially if you're cooking stews or like cooking the vegetable itself. You can buy the frozen vegetables or even fruits, and you can buy them when they're, you don't necessarily have to wait to buy them in season, because you can buy them year round. And then I had mentioned earlier, cooking in batches. That way you can kind of spread out what you buy, or you buy a bulk amount and then you can cook it for a number of days. And then you can also, if you're planning ahead, you can compare the unit prices and the stores that you can shop at. Sometimes some store brands often are like 20 to 30% less expensive than the big brands. So being able to plan ahead of knowing, okay, roughly what you need, or rough staples of what you need, you can kind of divvy up and be mindful of what types of brands you purchase in that way as well.
Those are some great tips. And one quick follow-up to that, I know you talked a little bit about rice. We got a question that came in. Which rice is better for CKD patients, white or brown rice?
I hear that so much. And a lot of that, I believe, has to do with previously, the old nutrition recommendations for kidney disease used to be to avoid whole wheat. And that's why oftentimes you might hear, oh, avoid the brown rice, whole wheat bread, only eat the white bread and white rice. Well, we have realized in more recent years that that's not always that helpful, because when we avoid the brown rice or the whole wheat breads or whole wheat in general, we lose out on a lot of nutrients and fiber. Let me backtrack. Back in the day, the avoiding whole wheat was recommended because of phosphorus. Yes, wheat has phosphorus, but just as Vanessa mentioned earlier, naturally containing phosphorus food items, they're absorbed at a much lesser amount than processed phosphorus. So now the recommendation is, to answer the question, either whatever suits you. You can choose brown rice, white rice. That's okay. Because we would much rather you have an abundant, like a variety of nutrients from one item, let's say brown rice, than to like that's better than to eat processed foods, or mostly processed foods. I hope that makes sense.
That's super helpful. And kind of what I'm hearing is with rice, it's really just all about variety too. You don't have to you can't just you don't have to stick to one. You can kind of include both of them. All right, so I'm gonna switch topics here a little bit. We've received a few questions on GLP medicines and their role with weight loss and managing diabetes and kidney disease. So Vanessa, this question is for you. What should people know about kidney-friendly eating if they're on GLP-1s?
Good question. I've worked with a lot of folks that are on GLP-1s, and a lot do have some kidney protective benefits. But when I'm shifting into eating and making sure that we're having enough food, because we know GLP-1s decrease appetite. So when it comes to kidney-friendly eating, we still focus on making sure that we're getting in like lean proteins into our diet. Muscle mass loss is can be a common side effect if we're not consuming enough calories, overall calories and protein. So that is something that can be concerning. Making sure that we're still increasing our intake of fiber in the form of like fruits and vegetables and like whole grains, because we definitely need those for kidney protection. And then making sure also that we're getting enough water. I do find that dehydration can be a challenge for folks that are on a GLP-1 because not only do they not sometimes have the desire to eat, but they can sometimes lose the desire to drink. And so we know that the kidneys do not like dehydration, right? And so we want to make sure that we are hydrating as best we can, just for your body, and then to also keep your kidneys happy. So when I'm looking at somebody's plate and I'm working with them, I want to make sure that we're having like a quarter plate of our, lean protein, a quarter plate of that starchy carbohydrate, and then we're trying to fill half of that plate of like fruits and veggies. Is every meal going to be that way? No, because we're not perfect and we're not looking for perfection here, but we want to strive for having those, most days of the week just to help with like for your kidneys and as well as for folks that are on, have diabetes, just for blood sugar balance and for kidney protection as well.
Thank you for giving us that overview. I also want to note we had a session earlier today that talked about medicines for people with kidney disease and diabetes, and we touched upon GLP-1. So if you guys didn't get a chance to watch it, you can definitely view that recording later on as well. Okay, so let's see. I'm getting a few other questions. All right, I want to switch to supplements now. So Kathy, I'll start with you. Are supplements necessary or helpful for people with kidney disease? Are there risks with taking certain vitamins or minerals without guidance?
Yes. Well, first question, are they necessary? Are supplements necessary? Not necessarily, especially if you're eating a variety of different foods. However, are there risks for taking certain supplements, without guidance? Yes, absolutely. So as I mentioned, not everyone with kidney disease needs a supplement. If you're eating what I teach my kids, of the rainbow, if you're eating a variety of different foods, most likely you're getting most of your vitamins and minerals. It wouldn't hurt to take a renal supplement if you have kidney disease. Oftentimes, renal supplements basically would have the vitamin B complex and C. However, it is very important you talk to your doctor or your dietitian if you do want to start any type of supplement, mainly because depending on what type of supplement you're taking, well, most supplements in general, they're not as strictly regulated as medications. And so depending on what brand you get, what kind of supplement you get, the doctor or the dietitian may be able to clue into, okay, is that good for you? Depending on your kidney function, will it build up? Because certain vitamins and minerals will build up if your kidneys aren't able to filter them as well. Especially with the fat soluble vitamins, they tend to build up if your kidneys aren't able to excrete them out. Other supplements that I've heard people take are kind of like teas or even different types of pills that they might get over in a different country or somewhere else that they heard someone tried and they would cure their kidneys. All to say, please, 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 if you are considering taking supplements, let your nephrologist know. And if you're working with a renal dietitian, ask them as well, because they can best guide you on what your body truly needs, because they're looking at your lab values.
Thank you. That's definitely some helpful information. And one follow-up question on supplements, and this one is for Vanessa. Can you tell us a little about B12 supplements for vegans and vegetarians? Are they safe or should people avoid them? And I know part of this question, Kathy, you answered, but if you have anything further on that.
Yeah, so just kind of piggyback of what Kathy said, having like a kidney multivitamin or renal multivitamin to be complex. There are some B vitamin deficiencies that can be associated with kidney disease. Now, that doesn't mean you freely go and take it. Like Kathy mentioned, definitely work with your dietitian and your doctor to get some lab values first. It's always nice to have a baseline to see kind of where you're at before starting a supplement. Now, when it comes to B12 supplementation, again, it's individualized, but if somebody, I would say, is like vegan, meaning they are not eating any source of animal products in their diet, they have a tendency to have less B12 in their diet. Now, does that mean they automatically need to be on a B12 supplement? Not necessarily. You can still strive to get some B12 sources if you are vegan. One in particular, nutritional yeast is one that I definitely love to recommend for folks that are or that I work with that are vegan. Now, it depends on some of the brands when it comes to like B12 as well. Some brands I think create a lot of fluff, and then there's other brands that are sourced very well. So again, it just depends on what that brand is, what your underlying numbers are, and then having that conversation with your healthcare team to figure out what's best for you.
Wonderful. Thank you both for sharing those good tips and information on all things supplements. Um, well, I can't believe how fast this time has gone by. You have both been so great. We are coming up, so I want to wrap us up with one final question for each of you. So, Kathy, I'll let you go first, but the question is, what is one message you want people to remember about working with a renal dietitian and kidney-friendly eating?
The best thing is just to be honest. It's okay to not understand. It's okay to ask again, because working with your dietitian should be a judgment-free zone. Because the more you ask, the more you let them know, even the struggles or feeling overwhelmed about something, th- knowing that can help the dietitian know how best to help. We can clue into those areas that you're struggling with or that feels overwhelming and try to find other strategies to ultimately help you. Because I really do hope that one day you can all come to see that the dietitian and the doctors aren't there to just tell you what to do. We really want this to be a team effort where we can walk alongside you in helping you feel your best.
Thank you. And Vanessa, same question for you.
Yeah, the biggest takeaway that I want to say is when you are working with a kidney renal dietitian, like please know we we love what we do, okay, and we are really looking at your best interest at heart. And so working with one, I will say our goal is never to take away from your plates. If anything, I'm going to want to add more to your plate. So I want folks to understand, like, I really want you to start reframing how kidney friendly eating should be. I have like seen just working with so many patients and clients, and then folks just reaching out on social media, how much frustration and how much like lack of joy that they experience just from having to be on a renal diet. And it pulls on my heartstrings a lot because there's a lot that folks don't necessarily have to restrict as much as you think. And so we really want, I really want folks to know like how I'm eating can truly help slow down and protect my kidney function. I know nobody wants to get on dialysis, right? And I've worked in dialysis, and I can see the angst that a lot of my patients felt, and so I really do stress encouraging folks to work with a kidney dietitian sooner. The sooner you start, oh my goodness, the more impact you can have on your nutrition to truly help slow down CKD progression. So I just want to say, like, we're here to help support you. We're not here to take foods away, and we really want to help you slow down CKD progression as best we can.
Thank you both. I think those are, just highlighting the importance of how dietitians are here to help. You guys have been wonderful today. Thank you so much for sharing your expertise in our discussion. And thank you for everyone who submitted questions. If your question did not get answered, we do encourage you to follow up with your healthcare team or dietitian that can help provide more personalized guidance. Don't forget to join us back here for tomorrow's session, How to Get Started, Your Path to Home Dialysis, which will be starting at 11 a.m. Eastern Time. As we wrap up this session, you will also see a brief survey pop up, so please take a minute to fill it out and tell us how we did. Your feedback is very helpful for us as we plan future sessions. Thank you, everyone, and I hope you all have a great day.